So take it away.
Thank you, Julia. So great to be here at another HITLAB monthly symposium, and actually the summit. So this is the big event of the year, and I'm really delighted to be joined by a couple of friends. This is an international panel, actually. We've got Dr. John Reeves from Conversation Health in Canada, and Francisco Narvaez, if I pronounce that correctly.
Beautifully.
Awesome. Who is from Axon Digital Health in Argentina. So we're going to have a conversation about how conversational AI is really transforming healthcare and could be revolutionary to the field of healthcare, as we'll find out. So I'm really interested to hear what both of these experts have to say. Briefly, my background, for those that don't know me, my background is in product development across industries, including aerospace, medical devices, and mobile devices. And over the last 10 years plus, I've actually been catalyzing digital health globally, starting in 2009 with the formation of the Wireless Health San Diego group on LinkedIn. So that was my first, that was the genesis of what is now the Digital Health Group, which is now almost 100,000 members globally. So with that, why don't we go to John first? And John, why don't you tell us a little bit about yourself and what conversational AI is, and then we'll jump over to Francisco.
Sounds like a plan. So I'm John. I'm a physician by training, started practice here in Canada, 1994, 1995. So if anyone can remember back, that was when the internet started. That's when websites started to pop up. And starting in 1995, I started building websites for large global pharma companies. I've been involved in digital since then. So I've been here through the web, the social. And what we're now going to talk about today is something so large that I actually call it the third horizon of digital. This is the conversational AI horizon. If we can all think back to those first two horizons, I think they were largely predicated on the concept of making content available to our customers. Now, as a physician, making all the content available to a patient sounds appealing, but is not always the best approach to driving them to success. So when I look at the third horizon of digital being conversational, we're really moving away from the concept of content to the concept of conversation. We all know that conversation is far more powerful than content. As an example, we don't go to our doctor's office and walk in, and the only experience is not just getting a brochure. The true experience is actually having a conversational experience with your healthcare professional. So I look at this third horizon as being, massively transformative, and it's one that's predicated on the movement away from not only content to conversation, but away from the episodic nature of healthcare to one that's continuous. Now, what is it that actually powers conversational AI? Well, really, you need to kind of tap into this growing capability of computational power and AI algorithms, which has allowed companies like ours to build conversational platforms. And it's these conversational platforms that can understand the human utterance or the input. And in healthcare, that's even more complex. And by understanding that, actually be able to match that up with a response. A response can take many forms in conversational AI. It can be a simple answer. It could be an escalation to a human. It could be a business process, or it could be an acknowledgement that this could be a potential adverse event. But more often than not, we look at it more as the conversational experience, which is not a simple answer. It's that back and forth that actually moves you from something that you don't know, oftentimes into something that you don't know, and can actually dive into those types of conversations. So it's super important that these platforms are not just about question and answer, but they also include these very, very rich conversations. Now, super important, of course, in this as well, for anyone thinking about conversational AI, is that it actually is pushed through a variety and an expanding set of conversational channels. We're all probably very comfortable and have experienced those small little windows that lay on top of a website, right? That transform a website from being a flat content experience to a conversational. But it can also be delivered through a mobile web experience or through a mobile, conversational app. And I think we'll talk a little bit more about that later. But also it can be voice-based through an Alexa device or through IVR or through a digital human. And so all of these now are new ways that brands can have conversational experiences. And of course, we all know that conversational experiences are not only incredibly complex, but incredibly powerful. And that's now the opportunity ahead of us. Just like in 1995, when we looked at the web and said, what will it do for us? I think we're sitting here very early in this conversational AI horizon, and we're saying, what can conversational AI do for us as companies, as business units and brands, now that we have this new massive capability in front of us?
Very nice. Thank you, John. And Francisco, your thoughts and your background, please.
Okay. Yeah, first of all, I don't have that fantastic baritone voice that John has. It's impressive. I'll be the tenor, musically speaking, here. But besides that, my name is, I will pronounce it in Spanish. My name is Francisco Narvaez. Even though you pronounced it beautifully, Paul, so kudos to you. But yeah, I am from Buenos Aires, Argentina, and I am the founder and director of Digital Health. We are a company that are providing digital solutions to the healthcare and pharmaceutical industry for a couple of years now. And we have developed several products in order to address some very meaningful and industry scale large necessities. One of those is adherence. We started by seeing that patients had everywhere struggle with with how to be more adherent to their chronic illnesses and to their chronic conditions.
Yeah.
And seeing the solutions in the landscape, we saw that they were lacking empathy, and they were lacking a way to reduce friction with patients and to help them, instead of providing them with many other things that they had to learn how to do. So that's where we created Adam. Adam is the first Spanish speaking digital assistant for patients. The first in Latin America, the first that we know of. So perhaps there's another one in other markets, but here we are the first ones. And the most interesting thing is that, as John was saying, we harness the power of conversation in order to help patients. And with that idea in mind, we try to be where patients are. So Adam is completely adaptable to many digital conversational platforms such as WhatsApp, Facebook Messenger, Google Assistant. Alexa is not as popular here, but I guess if it comes, we could use it. But yeah, the mainstream ones in Latin America, we are working with most of them.
Very interesting. Thank you, Francisco. And so maybe, I think, Francisco, you touched a little bit on the uses of it. And I think we talked about yesterday, we had a discussion about outcomes and improved patient outcomes, how those can be measured, what kind of data we have. And John, maybe you can go first, and then Francisco as well. We can look at what you guys are both seeing as far as results. And then maybe we can dive into the contrast between regional applications of conversational AI.
Yeah, no, happy to dive in on that. I think maybe just as a preface to that, I think it's important that people realize that, conversational AI is used in different ways. And so I think it'll be critical that you walk away recognizing that, oftentimes it's being used now to, let's say, for example, amplify your digital touch points. Sometimes it's used to either augment your existing human-to-human interactions. Sometimes we use brand new ways, as we talked about with voice, where it never existed before. Or sometimes we're actually automating the human experience. And so fundamentally, when you look at the kind of the patient experience and that journey, there are many points along that journey where they're either having a digital experience, they're having a human experience, where we can now apply this conversational AI touch point to enhance or augment that. So super important that you think about this as being a journey. It's not an episodic moment. And so as Francisco said, sometimes you're going to intercept a patient early in that journey. And that may mean that you might start having a conversational experience with a patient on a third-party property. You may or may not be aware, but you can actually have a conversational experience now through a banner ad. So on that third-party property, in a contextual moment, when a patient's looking for something, you can actually start a conversation with them at that moment, okay? You can then move them over to your digital property or to a social media conversational experience. And of course, you can then get them to register for kind of a back and forth conversation. That is so important in healthcare and moving beyond where we are now. The concept of being able to push information to patients at the right moment in their journey, at that moment of need, and have conversations with them about topics they don't know that they don't know, but absolutely need to know is absolutely critical. I think the foundation, though, of conversational AI in patients is the concept of making information available through a conversational experience 24/7 around condition, around product, around treatment options, about data collection. All of these things are absolutely important in managing that patient to success. And so it could be a financial conversation at that point in their journey. It could be about reminding them to take medication. It could be prepping them for a physician visit. These are the types of conversations that drive reach, frequency, and ultimately patient impact. I've always been a firm believer that putting the right information in front of the patient is what's going to activate them to success. Right? The concept of knowledge is power. So that's kind of the fundamentals of how you're going to engage your patients and drive them to success.
Yeah, thank you. And Francisco.
Yeah, I completely agree with what John was saying, and let me just add some couple of things. But one of those is, John early talked about when you go to your doctor, you have with them a conversation, and the main experience, it's not the visit, it's not the diagnosis, it's not the checkup, it's the conversation you have with your doctor. So it's that important, to have a good conversation. And any interaction with any digital or physical device, it's a conversation per se. And as John was saying, the ability to push content and to push this conversation in order to help patients with their behaviors and to help them with information, with key information in the right moment, it's crucial. And also the nuances and the tone that you can, you can dial with, and you can bring some detail into with a conversational platform rather than a static one. A website is a website, and it will always be in a kind of a same way, But a conversation and perhaps the more complex the platform is, the better. A conversational platform can take those specific nuances of what patients are telling you, and they can help with giving these kind of details. For example, you can clusterize people and and try to reach out to them in different moments in which these kind of specific patients will respond better to your messages, or in a way, with a specific message in which these other kind of people will respond better. So and that is very much alike a real visit to a real doctor, and John, you will agree with me, being yourself a doctor, that physicians have their doctor voices, and am I right? You have your human being voice and you have your doctor voice. What's the doctor voice? The voice you put on when you tell your diagnosis to a patient, for example. And it's graver, and it's very aplomb and very quiet and serene, and you are telling someone, you have this diagnosis and this is what you're going to do, and it's calming. And when you finish this bit of conversation, you go back to your human being. I'm kidding just now, but you know what I mean. It's like you come to your regular voice again, and that happens to a lot of patients. And why is it that? Because in that moment, that patient needs that nuance in the tone, that detail in the tone of the conversation, in which it is calming for them and soothing, and they help them absorb better that content. So I think that conversational platforms are in the verge of providing that kind of much richer interactions than any other platform, any other digital platform, because of this capability we have to, harness the power of nuance and detail.
Yeah,
That's actually, I'm just going to double click on that. That's a really interesting insight. And because what we're talking about now is that relationship between a patient and a physician. That's not always the conversation they want to have. Sometimes they want to have a conversation with a nurse educator. Sometimes they want to have a conversation with a pharmacist. Sometimes it's with a peer. And conversational AI platforms enable our patients to kind of choose, should you decide to provide that, who they have that conversation with. The other thing I would double click on would be that my physician voice would sometimes have been one of talking a lot and very quickly. Why? Because I have 6 to 10 minutes to try and impart upon a patient X number of topics. I can tell you that if you're thinking about a patient with a condition being put onto a product, there are roughly around 200 conversations or topics that you could have with that patient. And so physicians literally have to pick and choose a very small number. And even then, the vast majority of these topics are not retained by the patient when they leave. Conversational AI allows us to deconstruct those 200 and make them available at the right time, whether it be the patient asking or initiating those. But most importantly, we now start to deconstruct topics or content into bite-sized, memorable, visual, concepts that they can actually retain and then leverage going forward. That's really, really important. And then one last quick point. Even when you're practicing medicine, you recognize that there's a lot of things that your patients won't tell you or ask you. And these are things they won't talk to their best friends or their colleagues, nurse, pharmacist, doesn't matter. Conversational AI agents, as they get more and more complex and sophisticated, they overcome barriers of embarrassment and judgment, these key issues that inhibit patients from asking sometimes the most important questions that they need information on their journey. So this new environment allows them to actually ask those questions. And then as a builder or a sponsor of these solutions, you're now getting immediate insight as to what it is that your patient wants at particular points in the journey in the real world that they live in, not the world that we sometimes think they live in.
Totally right. And to double click on that, and then we can move to the next topic. But we have read several papers before we started with Adam, and one of the things that came to our attention was that it doesn't matter the digital mean you use to engage with patients. In a digital mean, for example, in a digital formulary, they tend to lie less than to their doctors. Mm-hmm. It's like it's statistically, confirmed. But it's not because of doctors are liable. You can lie to them, but it's because of this shame and this, not trying not to say things that perhaps are compromising for them or very private, or they are scared. If a doctor, if a physician asks you, have you been taking your medication for the last 6 months? You won't tell them, yeah, a couple of months ago, I forgot to buy it, so there was a week that I didn't take it. You won't say it. You will say, yeah, of course, every day, just as you asked me to do it. And even though it's a lie, it's something that patients do sometimes to avoid this kind of judgment, and they don't feel that they will be judged by this kind of conversational platforms. So as John was saying, we are able to untap these kind of conversations that won't even happen with not only physicians, with their closest friends or even their couples. So it's very interesting.
Yeah. And, listening to both of you, I'm struck by the fact that conversational AI is an extension of what the healthcare providers are doing, whatever role they're in, but particularly the healthcare system overall, and it's augmenting the healthcare in general. And so I know we're running short on time, so I wanted to ask both of you, with that in mind, how conversational AI can, augment healthcare, maybe expand access, what have you. Maybe the two of you could touch on what you see as the future of this kind of technology in healthcare, and perhaps, for example, maybe it's going to branch out of healthcare, and how is it going to connect consumer health to the healthcare system? I know, John, you mentioned, websites and how a banner could engage someone who's a consumer or patient and then bring them into the conversation, no pun intended. and connect them with a provider or maybe even a pharma company.
So Paul, I think you asked like 4 questions.
Pick whichever one you want. I think you might have froze up, John, on your
Yeah.
Francisco. Maybe you could. Oh, John's back.
So I was asking Paul, which question of those 4 did you want us to dive in on first?
Your choice.
Okay, let me talk maybe then, because I think what's critical is that people realize where we're going with this, right? So, you know, I kind of stated early on that this is like 1995, 1996, 1997. We're now working with over 20 pharma companies around the world, working on over 120 brands. And what we're seeing across all of them is this excitement about a net new capability and doing projects to understand how it will best affect their business, right? Yeah. How do they create relationships that are conversational in nature, where they become the communicator directly to the physician or to the patient to provide the information through this new kind of experience model, okay? I think that, you know, one of the things we did talk about yesterday was, you know, what are the barriers? I mean, are companies afraid of diving into conversational AI? And the answer should be absolutely not now, right? We're now 3 years into this, right? Testament to the fact that, you know, you have 120 brands that we're working with that are full steam ahead, opening up this new conversational channel. So whether it be, you know, regulatory concerns, adverse event, all of these obstacles have been overcome. And now what we're seeing is that our clients are now starting to realize that we can now move into this kind of next horizon of conversational AI, which is using and leveraging integrations into CRM systems, which, as I talked about earlier, takes the conversation away from being that episodic conversation, which is very much akin to maybe talking to a doctor in a walk-in clinic where he's meeting you for the first time, to an actual relationship where we know about you and we can start to personalize the conversations that we're having with you at every moment, which is far more akin to the relationship you would have with your physician that you see on a regular basis, who knows who you are, who knows what medications you're on, other conditions you may have. And then we'll have conversations which are far more personalized and far more powerful with you.
Yeah, and to that, I think, can you listen to me? Yes,
yep.
Right? Okay, sorry, I thought my microphone went down. So to adapt to that, I think that it's not quite if these conversational platforms are going to branch out from healthcare, but how are we going to branch in all of the tremendous technological efforts that are going right now with conversational platforms. You know, Google is developing this kind of conversational assistant that has the kind of news in order to help you. You know, you can talk to them about, I don't know, World War II, and then you can ask them about what were the tanks that the Allies were using, and they will understand in that context what are you asking for them, and you know it's a very complex matter of conversation, and I guess these kind of things, Google Duplex also, Alexa, and Cortana. I'm not talking about Siri because, you know, in Spanish Siri is really underwhelming. Yeah. But Alexa, Cortana, Google Assistant, and the likes, they are very powerful platforms, and they have very powerful tools in order for us to harness them and incorporate them, and also all of the other digital platforms, as John was saying. Companies right now, either pharmaceutical or healthcare providers, they are not scared anymore. They're not asking what if this regulatory process. No, they ask, how do you overcome this kind of process? How do we do to step up into the regulatory game, and how can we do it? That's what they are asking. Even us in Latin America, that could be a couple of steps behind. But the thing is, I guess there are two very important movements that we're going to see in the next couple of years. One of those is the incorporation of this kind of very complex tools that will give a very interesting follow-up to patients and to people in any health condition. And the other one is the democratization of this kind of tools, because they are they're providing a very interesting impact in the low-cost part of the healthcare community. Here we are starting with a pilot program with we're trying to make a clinic, a study with an endemic disease that is from South America. That it's called the Chagas disease, which is caused by a very small bug called the vinchuca, and it's it's a headache for the region, for Argentina, for Paraguay, for Brazil, for a very large area of the merge of those countries. And thing is, that's where the lowest income population is in many of our countries. The people with lowest income in Argentina are in there, but they all have a mobile phone, and they all use WhatsApp or SMS, so they are able to access some kind of care that they wouldn't be able to if it were a physician that goes in person, that they receive one every 6 months. So the democratization of healthcare will be very much assisted by this kind of conversational platforms.
Yeah. Well, thank you, Francisco. John, it certainly sounds like the future is already here. The technology is robust, and it's really just not fully distributed. And so, John, you mentioned the number of clients you're working with, and Francisco, I know you're working with a bunch as well. So as that starts to disseminate and scale across the globe, really, I think the benefits and advantages for healthcare and democratization, as you touched on, Francisco, are profound. So I guess in that sense, we are seeing conversational AI revolutionize healthcare. So I think it's fantastic. Thank you both for joining us at HITLAB. And Julia, with that, I think we can conclude our panel here. Thank you.
Absolutely. Thanks very much, Paul.
Thank you very much.
Thank you, John.
It's been a pleasure.
Now.